All right, I'm Tim Black. You're tuned into TBTV. You know, Bernie Sanders did really well in Iowa. He's poised to do well in New Hampshire. Tomorrow is the big day in New Hampshire. Today is Monday. Tomorrow's Tuesday. That's when it goes down. But yesterday, Sunday, Bernie appeared on CBS's Face the Nation. Margaret Brennan was the host. And wow, folks, we got a lot to talk about in this little small space of time with this interviewer who, for some reason, did not get the memo about Bernie Sanders. Or maybe she did get the memo. Maybe that's what the problem is, because she was told to use all of these whack talking points. Here goes Bernie Sanders on Face the Nation. Check this out.
How do you plan to keep that edge and win on Tuesday?
We are running all over the state. We're talking to as many people as we can. We're talking about what our agenda is, which is an agenda that speaks for the working families of this country, an agenda that is prepared to take on the powerful special interest that have so much influence over the economic and political life of our country. And by the way, we're going to contrast our views with Mayor Buttigieg. And one of the areas of contrast, to be honest with you, is that last count, he has about 40 billionaires who are contributing to his campaign, the heads of the CEOs of the large pharmaceutical industries, the insurance companies, and so forth.
Why does that matter?
Well, on the other hand, it matters enormously. That is precisely the problem with American politics. When you have the heads of large pharmaceutical companies contributing to your campaign, you are not going to aggressively deal with the fact that in some cases we pay 10 times more for the same exact drugs as our friends in Canada or in Europe pay. You're not going to take on the collusion and the corruption of the drug companies who are ripping us off every single day. 1 out of 5 Americans cannot even afford the prescription drugs their doctors prescribe. So do you really think that when somebody gets contributions from the CEOs of drug companies, they're going to stand up to the greed and corruption of that industry? I don't think so. But it's not only the pharmaceutical industry.
But when you were standing
it's
on
other
that
industries
when
as
you
well.
were standing on that debate stage on Friday, you said that Democrats would come together and support a nominee. Are you saying
Yes.
Bernie Sanders will support Pete Buttigieg if he ends up being the nominee,
No,
or even Mike Bloomberg,
Absolutely.
a billionaire himself?
No, I did not say that at all. I think all of them will be far preferable to Donald Trump, who is the most dangerous and corrupt president in the modern history of this country. We have got to defeat Trump.
Sorry, to be clear, you would support either of them if they end up being the nominee?
Margaret, I have said from the first day of this campaign that it is absolutely imperative that we defeat Donald Trump. Of course I will support who the Democratic nominee is. But in the Democratic primary process, I will distinguish myself, differentiate myself from the other candidates. And one of the areas that I differentiate myself is we have raised more campaign contributions from more Americans, averaging all of $18.50 than any candidate in the history of this country.
It's almost like Bernie was talking to himself, because Margaret wasn't listening to anything he said. Nor was she interested in when he talked about issues that affect working families. He started off, working families across the country are getting screwed by special interest groups. She didn't ask him, like, what special interest groups? How are we getting screwed over? Why are working people having such a hard time? No, she went right for the low-hanging fruit. One of the things I did like about this interview, though, is that Bernie Sanders did not take her bait. He answered her questions, but he kept the focus where it needs to be, contrasting himself with Pete Buttigieg, which Margaret apparently has a problem with, because when he pointed out that Pete Buttigieg takes all this money from billionaires, all of a sudden Margaret doesn't live in the real world, and she thinks that money has no bearing on anything. I mean, it's a very simple question. If you're being paid, if you're the way that you're able to run, if you need money from the same people who you need to challenge, will you be willing to challenge them? If Pete is taking money from billionaires, is he going to raise billionaires' taxes? If Pete's taking money from people in the industry, the pharmaceutical industry, is he going to cut their profits? Now, I don't know what world Margaret lives in or what world these cable news people like Margaret live in, but that doesn't make much sense to an average working person. And, of course, the kicker was, Bernie, will you support the nominee of the Democratic Party? You know, the party that you're running under. Whoever that nominee is, will you support him? This is such a tired question, folks. Every candidate who runs under the Democratic platform party name has agreed to endorse and campaign for the nominee. Whoever that person is, this is a non-issue. This is not a question that needs to be asked. The sheer virtue, the sheer fact that Bernie's running as a Democrat means he will support whoever that person is. But as Bernie pointed out, and Bernie tried not to get too pissed off, but you could tell he was getting a little upset here. Because it's like, Margaret, I've already said this 100 times. Everyone knows I will support the Democratic nominee. But during a primary, we're running to be the nominee. So we are able to, point out issues that we differ with other candidates on. That's how people decide who they want to support, who the voters will vote for. It's based on the differences between the candidates. And it's a very important difference to some of us. If we have one candidate who's taking money from the drug companies when I want drug prices to go down. And Bernie was trying to also say, or she cut him off when he said, it's not just the drug companies, other industries as well that Pete's taking money from. But he couldn't get the rest out because Margaret wanted to accuse him as if he wouldn't vote for or wouldn't support Pete or Biden or Klobuchar or whoever if they were able to cheat. If they were able to win. It gets worse, so here goes a little more of that. As now we go into even further darkness as Margaret Brennan talks about Bernie in the Iowa caucuses.
Your campaign reported some inconsistencies in the results out in Iowa, as did two other campaigns. Columnist Peggy Noonan wrote this: "They can't run a tiny caucus in a tiny state, but they want us to believe they can reinvent American health care." How damaging is it that the Democrats couldn't get this right?
It is damaging, and it really saddens me because, I went all over the state of Iowa, and they're beautiful people, good people, who take their responsibility seriously. And the fact that the Iowa Democratic Party, that has received all kinds of money, could not count those votes in a timely manner is really a sad state of affairs.
Right, but you're advocating for the empowerment of the U.S. government to take over the entire health care system. This just optically looks like the party can't run its own caucus.
Margaret, that's not a true statement. I'm not advocating for the United States government to take over the health care system. What I am advocating for is an expansion of Medicare. Medicare exists.
Right.
I want to expand it over a 4-year period.
Which would be administered by the U.S. government. And
Precisely, just as Medicare is right now. But it's not a takeover. People will still go to the same doctor. They'll go to the same hospital. We will substantially lower the cost of prescription drugs. The cost per person will go down.
Right,
People will be paying less for health. But it's not a takeover.
The nub of the criticism, though, is that this is a question of competency. And straight out of the gate, how do you reassure the public that the party whose ticket you are running on can do this and do this successfully in the states ahead? Nevada is already saying when it comes to their caucuses, they're short of volunteers. Our campaign reporter says they're short 1,000 caucus chairs, and they might have to even hold 2 caucuses at once. This doesn't look efficient.
Well, all right, that may well be the case, but let's get back to the United States government. I'm not the chair of the Nevada Democratic Party.
You told my colleague Nora O'Donnell recently on CBS that you couldn't put a price tag on your health care plan and your proposals. But I want to ask you for some clarity here, because back in July, you told the Washington Post Medicare for all would cost between $30 to $40 trillion over 10 years. Do you still trust those numbers and those estimates?
Sure. All that I said, the answer is yes. But all that I said is anybody who tells you what anything is going to cost in health care, it's not telling you the truth. There is so much. It's so big. If we do nothing,
so it's not
the health
30
and human
to 40
services
trillion
over a 10-year period.
Okay.
Sure. I mean, the problem is we are already spending about 50% of healthcare dollars already come from the federal government. We got to add the other 50%. But here's the main point that people should appreciate. If we do nothing, according to Health and Human Services, we're going to be spending $50 trillion. We spend twice as much per capita on healthcare as do the people of Canada or Europe. So, of course, we can provide healthcare to all people spending less than we are doing now, because we're going to end the $100 billion in profiteering that goes to the drug companies, that goes to the insurance companies, and the hundreds of billions of dollars in administration of thousands of separate plans, an enormously complicated and wasteful system.
Senator Sanders, thank you for your time.
Bernie Sanders has to have the patience of a saint in order to deal with Margaret Brennan when it comes to these issues. First of all, who cares what Peggy Noonan thinks? She's just a person who writes articles. Well, we got to sit here and rebut Peggy Noonan in order to validate our beliefs that Medicare for All should exist? And what does that have to do with the Iowa caucuses? This makes no sense. The Iowa Dems are not going to be running Medicare. So why does it matter if the Iowa Dems had a problem in Iowa? How are you using that to explain that Medicare for All would somehow be mucked up? Doesn't make sense at all. And the way that Margaret presents this argument is as if we don't already have Medicare in place now, which services millions of people daily. So is that system jacked now? Is it so bad now that it's horrific? Or is it the most highly rated healthcare system that we have so far? I think it's the most highly rated healthcare system that we have so far. Could it use improvement? Of course it could. Let's improve it. This is not a takeover. This is an expansion of a current system. People would keep their same doctor. You can go to the same hospital. There will be no in-system or in-network, out-of-network garbage because you switch jobs like we currently have. What's going to really change is the price. You're not going to pay anything up front. And if you lose your job, you don't lose your health coverage. Why doesn't Margaret focus on any of these questions? Why aren't any of these points worth talking about? Because Margaret is there to take a dump on Medicare for All and Bernie Sanders, not to actually give information. It's as if he's having a debate with Amy Klobuchar instead of talking to a journalist about his stances and about his policies. Why is that? We know why it is, Johnson. They're on the same team as Amy Klobuchar and Joe Biden and Pete Buttigieg. The idea that we are going to pay so much money for Medicare for All is a disingenuous standpoint to take if you don't acknowledge we're already paying a lot of money for subpar health care coverage now. We're already paying $50 trillion over a 10-year period. We're going to clean out all of the overcharging, all of the overbilling, the double billing, and all of the monotonous paperwork that's involved that inflates prices. And we're going to take a lot of the profit motive out of the system. As I watch this, as you watch this, it's hard to imagine that this is the cable news media is where you're supposed to get your news, when they're able to create false narratives. It's like a debate, frankly, and it should be an interview. It should be a discussion of the issues, not Margaret playing Peggy Noonan or Margaret Brennan pretending to be Joe Biden in the interview. All right. I'm Tim Black. Subscribe to this channel. Become a member of the Tim Black Wolf Pack. There's more to come. We're going to New Hampshire. We got to talk about that as well. Horrible.